The core is a generalized term that describes the muscles of the abdomen, the low back, and some of the hip muscles. We found that these exercises help protect the spine from injury, and in fact that when people injure their back, certain muscles of the core are inhibited. So what happens is these muscles become deconditioned, weakened. If we can interfere with that downward spiral, we can prevent further injury. People who are fit have less injuries than people who are not fit. This program is not for everyone. This is a generalized program, but there should be specific adaptations of this program by your chiropractor, or therapist, or doctor for each individual person. Place the fingers of one hand on the muscles of your lower back, immediately to the side of your spine. Place the other hand on your lower abdomen. Bend at the waist until you feel the muscles of your lower back contract. Be sure to note how this feels under your fingers. Then rise up and arch your back until you feel the muscles relax. Now tense or stiffen your abdominal muscles until you can feel the lower back muscles contract again. This contraction, or co-contraction, is called bracing. Bracing will be used to enhance some of the exercises that will be demonstrated in this presentation. This exercise is not considered a stretch, but rather a motion enhancer. The intent is not to stretch to end range, but rather to improve the motion between the adjoining vertebrae. It begins in the quad stance, kneeling on your hands and knees, with your hands and knees shoulder-width apart. Curl your spine into a comfortable position. Pause, and then arch your spine down. Do not stretch to end range. Perform this exercise 6 to 10 times. Those with herniated disc or sciatica should limit the curling portion of this exercise. If pain is produced, stop or modify the exercise. Do not work through the pain. This exercise is intended to work the abdominal muscles of the front of the torso while protecting the lumbar disc. Lay on your back with your forearms under your lower back. This is intended to maintain the normal curve of the lumbar spine. Remember that flexion, bending at the waist, increases the pressure within the lumbar disc. One knee is bent and the other is straight. The exercise is performed by curling the upper back up while maintaining the neutral spinal curve. Avoid jetting the neck or head forward while performing this exercise. Concentrate on maintaining good form. As fitness improves, you may increase abdominal involvement by concentrating on the purposeful contraction of the abdominal muscles. Alternate the legs at the midpoint of repetitions. Hold contractions for up to 8 seconds. Build muscular endurance by gradually increasing the number of repetitions. From the quad stance, brace your core while maintaining a neutral curve in your lumbar spine. Lift one leg and the opposite arm parallel with the ground. Do not extend your head or neck or overextend your legs. Hold the arm and leg in this position for 8 seconds. Then repeat on the other side. As strength and fitness improves, add more repetitions of this exercise rather than holding the arm and leg up for longer periods of time. 5 to 10 repetitions should be ample to begin with. If this exercise is too difficult, it can be modified to reduce the strain. You may reduce the burden by raising only an arm or a leg, or by placing an exercise ball under the abdomen for support. Stiffen your stomach and back muscles into a brace and strive to keep your spine straight. Move your hips forward and form a bridge with your body. Your elbow will prop up your upper body and your feet will support your lower body. The top foot should be in front of the bottom foot. This exercise should be performed on both sides. If additional shoulder support is needed, use a hand to support the shoulder. Hold contractions for up to 8 seconds. Build muscular endurance by gradually increasing the number of repetitions. A lower level of intensity for this exercise can be obtained by bridging from the elbow to the knees. Patients with shoulder, arm, or wrist disorders or weakness may use this alternative exercise to strengthen the muscles targeted by side bridges. Lie on your side with your knees bent. Straighten and raise your legs while bracing your abdominal muscles. Hold for up to 8 seconds. Planking involves stiffening your body into a plank while supporting yourself on the balls of your feet and your elbows. Concentrate on stiffening the back and abdominal muscles while maintaining a stiff posture. An advanced version of this exercise would include placing the elbows on an exercise ball. This will challenge the spine with the additional benefit of balance and reflexive contraction of the core muscles. Hold contractions for up to 8 seconds. Build muscular endurance by gradually increasing the number of repetitions. With increased fitness and strength, some will be able to combine side bridges and planking to create a more focused core workout. Hold for 8 seconds in a side bridge. Then transition into the plank for 8 seconds. Then into a side bridge on the other side. By transitioning from side to plank to side, the core will be amply challenged. Core endurance is more important than core strength. Avoid focusing on sets and reps, and do not attempt heavy exertions when training the core. The core stabilizers respond better to a little exercise every day than to performing exercises aggressively 2 or 3 times a week. There's no such thing as a one-size-fits-all program. Specific exercise programs are only appropriate for specific populations. Protecting the natural curves of the spine. Forward bending of the spine increases the pressure within the disc and has been indicated in spinal injuries. Do not base your core exercise program on sit-ups or crunches. Sit-ups and crunches reproduce these injurious motions. In addition to core stabilizing exercises, aerobic fitness has been shown to be beneficial in preventing low back pain. Select 1 or 2 aerobic exercises that you enjoy that do not provoke back pain. Perform them for 45 minutes, 4 days per week. Selecting 2 different types of aerobic exercises provides diversity and varies the stresses on the muscles and joints. You may choose walking, swimming, cycling, deep water running, elliptical machines, stair climbers, or dancing. A comprehensive program of spinal fitness would include specific core exercises, strength training, motion exercises, aerobic fitness, and ergonomic training. While there is no one cure for the many causes of back pain, following a prescribed program will reduce your risk of further injury.